In this video, we are going to be looking at the topic adverse events of faulty insulin injection technique. Hi, I'm Sharon. I'm working as an assistant professor at College of Nursing. The following are the objectives that we'll be addressing in this video. Insulin is a hormone our body makes to keep our blood glucose levels within the normal range. It is made by beta cells in the pancreas. Insulin's main job is to move glucose from the bloodstream into the body cells to make energy. If there is not enough insulin, glucose builds up in the bloodstream rather than getting into the cells to provide energy, causing hypoglycemia. With type 1 diabetes, the body does not make any insulin and therefore insulin has to be injected regularly every day to stay alive. Whereas with type 2 diabetes, the body does not make enough insulin or the insulin that is made does not work well. Hence, insulin injections are sometimes needed to manage the blood glucose levels. Before we move into the topic, we need to be aware about a few terminologies. Adverse event. It is an event in which the care resulted in an undesirable clinical outcome. Insulin injection. As discussed earlier, insulin is a hormone made in the pancreas. It allows the body to use glucose for energy. Injections of insulin can help manage both types of diabetes. The injected insulin acts as a replacement for or a supplement to the body's natural insulin. Faulty technique. It is the incorrect way of giving the insulin injection. In the upcoming slides, we will be looking at each of the adverse events in detail and ways to prevent it. Pain. It is the commonest adverse event associated with insulin use. Good injection practice can minimize or avoid injection associated pain. Now, let's look at the ways to minimize pain associated with insulin. This can be done in 3 phases: pre-injection, during injection and post-injection. In pre-injection, appropriate messaging, that is, convey the benefits of insulin in a positive manner. Next is selection of appropriate insulin, site, device, needle's gauge and length. Use new needle for each injection. Use concentrated insulin if the dose requirement is high. Use neutral pH insulin if pain occurs with acidic pH insulin. And insulin should be at room temperature prior to administering. During injection, do not raise a tight, blanched or painful skin fold. Allow topical alcohol, if used, to evaporate. Avoid injecting at hair roots and over bruised or traumatized sites. Penetrate the skin quickly. Use distraction methods in children and do not move the needle after insertion. In post-injection, release the skin fold if raised slowly after withdrawing the needle and follow correct side rotation policy. Lipohypertrophy. This is a thick, soft, firm swelling with rubbery consistency that appears on the surface of the skin at the site of insulin injection. This is usually due to repeated reuse of needles at the same injection site. Appears as a raised swelling which cannot be pinched together. Large sites can be seen on inspection, others may be evident on palpation. This causes significantly unpredictable and delayed absorption, causing glycemic variability and unexplained hypoglycemia. This is a case of lipohypertrophy in type 1 diabetes mellitus patient who is 10 years old and who has it for 5 years. So it is necessary to inspect and palpate the site. So in the arms, both arms, right and left, we can see the visual bump, whereas in the thigh, on palpation it can be felt and you can notice the skin discoloration. This picture shows classical lipohypertrophy. So how can lipohypertrophy be prevented? This can be done by regular inspection and palpation of insulin sites, that is self-insulin site examination. Single use of needles. Do not use the same injection site repeatedly by following the correct site rotation policy and use larger injection surface areas. Let's look at the management. Do not inject into LH sites. Reduce the dose of insulin in habitual LH site injections when shifting to normal subcutaneous tissue after consulting physician. Rule out LH as a cause of poor glycemic control, hypoglycemia, and high glycemic variability. Injection sites should be inspected and palpated for LH by both healthcare providers as well as patients with diabetes. Bleeding and bruising. Occasionally, there can be bleeding or bruising from the injection site. It is usually not significant and it is less frequent with the use of shorter needles. Let's look at the tips to prevent bleeding and bruising. If bruising occurs persistently, injection technique must be reviewed. Sites with bleeding and bruising should be avoided until fully recovered. Avoid injecting into blood vessels and hair roots. Assure patients that bleeding and bruising do not appear to have adverse clinical consequences for the absorption of insulin or for the overall diabetes management. Needle stick injury. It is common among healthcare providers. Use of safe medical instruments and the appropriate training on preventive measures are needed to ensure safe practice. Leakage of insulin. Leakage from pens can occur due to a poor seal between the needle and the cartridge or incorrect positioning of the plunger reflex or backflow out of the injection site can happen when the needle is taken out too soon or in an obese patient. Amyloidosis. It is a rare disorder where an abnormal protein called amyloid is deposited extracellularly and impairs tissue function. Studies have shown amyloid deposition at the site of repeated insulin injections in patients with diabetes. It may be associated with the use of insulin, including human recombinant insulin, and this may contribute to insulin resistance or refractoriness in poorly controlled patients with diabetes. The nature of amyloid, the insulin itself or insulin related substance, and has been identified as amyloid insulin type, otherwise known as A insulin. Marked improvement in blood glucose has been noticed shortly after resection of the mass or change of the injection site. To avoid infection, inflammation, or mass formation, educate patients with diabetes about regular checkup of injection site and alternate use of insulin injection sites. Lipoatrophy. It is clinically categorized by visible cutaneous depression and palpable atrophy of subcutaneous fat tissue at the injection site. It is an immunological response to insulin aggregate on the presence of high circulating titers of anti-insulin autoantibodies. Scarring. It is a consequence of the wound healing process that occurs when body tissues are damaged by a physical injury. Repeated injections into the same subcutaneous tissue and increasing use of insulin pump therapy carries risk of abscess formation and scarring. The following are the references for this particular topic. Thank you.